Welcome back to the Deep Dive. Today we're taking a closer look at, well, AI in healthcare.
Sounds pretty timely, right?
Absolutely. It seems like every day there's some new headline about how AI is going to revolutionize, well, everything.
It really does.
So we thought it'd be fascinating to kind of step back from the hype a little bit
Right.
and actually examine how AI is being used, on the ground in healthcare.
Absolutely. Get into the nitty-gritty.
Yeah, yeah. And for this deep dive, we've got some amazing material to work with.
Yeah, we do.
Excerpts from a talk given by a Stanford professor.
A real expert in the field.
Exactly. And, our mission here, what we want to really understand is the impact of AI in healthcare.
Not just the tech itself, but how it's actually affecting, patients.
Right.
Doctors.
The whole healthcare system.
The whole ecosystem.
So some big questions we want to explore. How can AI help doctors make better decisions and even faster?
Faster, yeah. More efficient, hopefully.
Right. Can it help us predict things like who might benefit from end-of-life care conversations sooner?
That's a big one.
It is. And can AI actually, help healthcare systems save money
That's the hope. Right.
while at the same time improving patient care?
Right. Finding that sweet spot.
Okay, so to help us unpack all of this, we have, you,
Oh, me.
an expert in, you tell us.
I focus on the intersection of AI and healthcare policy.
Perfect. Perfect. Okay, so where do we even begin with this?
Well, you can't really talk about AI in healthcare without talking about data.
Okay, data. AI loves data.
Right, it's the fuel.
But healthcare data, is that a special kind of data?
Oh, it's a whole different animal.
How so?
Think of it this way. Instead of like a snapshot, it's more like a long, winding novel.
A novel.
Interesting.
Yeah, you're dealing with a patient's entire history. Every hospital visit, every medication they've taken, every test result, every doctor's note, everything. Wow, okay, so it's not just analyzing a single moment in time.
No,
It's like understanding the whole narrative.
The whole journey, their health journey.
Right.
And that's where it gets really, really tricky.
Right?
Because this novel, it's often scattered across different systems collected over years and years with potential gaps, inconsistencies.
Oh, I see.
You rarely have a complete, up-to-the-minute picture of a patient's health.
That sounds like kind of a nightmare for AI.
It is.
How can it build accurate models with all that mess?
Well, Stanford realized this early on.
Yeah.
They started investing heavily in data infrastructure back in 2005.
Wow, that's really forward thinking.
Yeah, they were ahead of the curve. They knew that high-quality data was going to be the foundation for everything.
So they were building the foundation before they even knew what kind of house they were building.
Exactly. And now they have this unified data platform that allows them to kind of connect the dots, pull out meaningful insights from all of this data.
Okay, so what's AI actually doing with all this data?
Well, think of it this way. It has two main jobs.
Okay.
One, helping doctors decide whether to treat, and two, how to treat. And these decisions, they're being made all the time,
Yeah.
every day in every clinical setting.
Right. Can you give me like a real-world example of how that work?
Sure. So let's say a patient comes in with a cough, a fever.
Okay.
The doctor needs to figure out, okay, is this something that needs treatment?
Right.
And if so, what's the best treatment? AI can analyze that patient's data, consider similar cases, and offer recommendations.
Okay, so it's like having a super smart assistant who's read every medical textbook.
Yeah.
And can instantly pull up relevant information.
It's a great analogy.
Okay, so it's helping the doctor make those decisions. But how does it actually do that?
Well, one way is by acting as a kind of medical detective, right? We call that classification or diagnosis.
Wow.
So think about analyzing an image to see if there are signs of pneumonia.
Okay.
That's AI using data to figure out what's already there.
Right.
But AI can also predict what might happen.
Oh, interesting.
That's prediction or prognosis.
Okay.
So here it's using data to forecast future events.
Oh.
Like a patient's risk of developing a certain condition or their chances of recovery.
So it's like having a crystal ball kind of.
It is pretty remarkable.
Yeah, it really is.
And we're also seeing this new thing called generative AI being used.
Oh yeah, generative AI. That's That's everywhere now.
It is. And in healthcare, it can take all this complex data
Okay.
and summarize it into like these really digestible reports for doctors.
Oh, I see.
So instead of wading through, pages and pages of notes, they get this concise summary
Yeah.
that's AI generated.
Okay, that makes a lot of sense.
Mhm.
But how does all of this amazing technology actually translate into benefits for patients?
All right, so it's not just about the technology itself, it's about the impact.
Yeah.
Well, the professor uses this great example, a heart condition called heart failure with preserved ejection fraction,
Okay.
or HFpEF.
Okay.
Now, this used to be considered just one disease,
Okay.
but AI helped researchers discover that it's actually 3 distinct conditions
Oh, wow.
by analyzing all this patient data.
So AI helps solve a medical mystery.
It did.
That's amazing.
And it shows how AI impacts healthcare in 3 ways: science, practice, and delivery.
Okay, break that down for me.
Sure. So first, the science level. AI advanced our understanding of HFpEF by revealing these subtypes,
Right.
each with a different prognosis. Then, the practice level, we can now develop specific diagnostic tests for each subtype,
Okay.
create tailored treatment guidelines.
So it's like AI gave doctors a much more detailed map of the disease.
Exactly.
Okay.
But the final piece, and it's often overlooked, is delivery. It's not enough to have the knowledge and the tool. The healthcare system actually has to implement these discoveries,
Yeah.
adopt new tests and treatments, improve care coordination.
Right. So everything has to change to support these new discoveries.
Exactly.
Okay, so that makes a lot of sense. And it sounds like it's pushing the healthcare system to evolve.
It is. It's pushing it to be more efficient, more patient-centered.
That's great. So can you give me another example of AI in action?
Absolutely. The professor talks about this project called the Green Button.
The green button. Okay.
Yeah, it was this AI-powered service at Stanford.
Okay.
It could give doctors data-driven insights on similar patients,
Hmm.
all within a single day.
A single day. That's really fast.
It is.
How is that even possible?
Well, remember how Stanford has been investing in that data infrastructure?
Right. The foundation.
Yeah, it paid off here.
Yeah.
This project was designed to address a pretty shocking statistic. 80% of medical decisions are made without solid evidence.
80%. Wait, really? That's a little unsettling.
It is. Doctors often have to rely on experience, intuition,
Right.
limited information. The Green Button gave them access to all this data on similar patients so they could make more informed decisions.
Okay, so it's like AI is giving doctors a cheat sheet, but in a good way.
Yeah, a cheat sheet for better patient care.
Okay. Is this green button still in use?
Well, it's evolved. They created a company called Atropos Health
Okay.
to make this technology available to other healthcare systems.
Oh, that's great. So they're not just keeping it to themselves.
No, they want to make a real impact.
Yeah. Okay, so we've talked about, helping doctors make better decisions, but what about the ethics of all this?
Right. The professor talks about another example, using AI to predict mortality.
To predict. Okay, that sounds a little bit ominous.
I know. But the goal wasn't to make some grim prediction about someone's lifespan. It was to identify patients who might benefit from having end-of-life care conversations sooner.
Right.
So not predicting death,
Yeah.
but improving the quality of life in the final stages.
Right, and making sure that their wishes are respected.
Exactly.
Okay, so how did they address the potential for, misuse of this kind of technology?
They were really careful. They worked with a patient advisory council
Okay.
to make sure it was focused on improving care
Right.
and that it wouldn't be used for things like insurance pricing
Right.
or, selective enrollment in healthcare plans.
Yeah, okay, that makes sense. They're trying to walk that line
Yeah,
between the benefits of AI and making sure it's used responsibly.
absolutely. And it brings up another important point. Having these powerful AI insights is great.
Yeah.
But only if you can actually act on them.
What do you mean?
He uses this analogy of the Mercedes-Benz logo, the 3-pointed star.
Okay, yeah.
He says the 3 points represent models, workforce capacity, and policy. All 3 have to work together to actually drive change.
So you could have a fancy car with a powerful engine,
Right.
but if there's no driver and no roads to go on, it's not going anywhere.
Exactly. And that's the trap that a lot of people fall into with AI. They focus on building these sophisticated models, but they forget about the implementation,
Right.
the resources, the people.
Okay, so it's not just about the technology, it's about the whole ecosystem.
Exactly.
Right. So speaking of exciting new technology, what about generative AI?
Ah, yes, generative AI, the buzzword of the moment.
It's everywhere. Everybody's talking about
It's going
ChatGPT.
to revolutionize everything, right?
Right. So what's the professor's take on all this hype?
Well, he acknowledges the excitement, but he also urges caution.
Yeah.
He did his own deep dive, analyzing over 520 research papers on generative AI in healthcare.
Oh.
And the findings are pretty interesting. Most studies are using non-patient data, and they're focusing on things like answering those USMLE questions, the exams medical students take.
Right, right.
So they're testing AI's medical knowledge, but not necessarily its ability to function in the real world. And that's where we start to see the limitations.
Right.
For example, ChatGPT can give inconsistent answers.
Hmm.
There are high error rates when it's trying to complete medical tasks.
Okay.
And surprisingly, there were no real productivity gains when it was responding to patient messages.
So it's not quite living up to the hype.
Not yet. He emphasizes the importance of, rigorous evaluation and setting realistic expectations. It's still early days.
Right.
We need to be careful about getting swept up in the excitement.
Yeah, we don't want to get ahead of ourselves. Okay, so if ChatGPT isn't the answer, what is? What does the future of AI in healthcare look like?
Well, the professor's work offers a really intriguing direction. They're training AI on the language of patient timelines.
Language,
Yep.
what does that even mean?
I know, it sounds a little strange, but think back to how we talked healthcare data as this timeline of events.
Right. Diagnoses, medications, lab results.
Exactly. To a computer, that sequence looks a lot like a language,
Oh, okay.
with its own grammar and patterns.
So AI is learning to read the story of a patient's health.
You got it. And by learning this language, AI can actually predict future events,
Wow.
outcomes, with incredible accuracy.
That's pretty amazing.
It is.
So how is this different from the models we've already talked about?
Well, the key here is efficiency.
Okay.
This method needs far less data to train effective model.
Less data. That's a big deal.
It is. They were able to get the same level of performance with a small sample of cases as a model trained on mountains of data.
That's incredible.
It is.
Yeah.
And as with any powerful technology, there are considerations. Stanford is very aware of that.
Okay.
And they're working to ensure this technology is developed and deployed responsibly.
That's good to hear.
Yeah.
So we've covered a lot of ground here. The challenges of healthcare data,
Right.
the different ways AI is being used, diagnosis, treatment, even end-of-life care.
And we talked about the importance of workforce capacity, policy, making sure everything works together.
Right. Not just the technology itself, the whole ecosystem. And we even touched on generative AI, the hype, the reality.
Right.
It's a lot to take in. But it's fascinating to see how AI is already making a difference.
Absolutely.
The Green Button Project,
Yeah.
helping doctors with real-time insights, discovering new subtypes of heart conditions.
Mhm.
Pretty amazing.
It is. And it makes you wonder, what's next? What does the future hold?
Yeah, it does feel like we're just scratching the surface.
Absolutely. The field is evolving so rapidly.
Right.
What's cutting edge today might be commonplace tomorrow.
It's exciting. And a little bit daunting too, right?
It is.
AI has so much potential, but we need to make sure it's used for good.
Absolutely. The professor really emphasizes that AI in healthcare should be about more than just the technology.
Right.
It's about making a real impact on people's lives.
Right. It's about empowering doctors, improving patient outcomes,
Yeah.
creating a healthcare system that works for everyone.
Well said.
So for you, the listener, as AI continues to evolve, how do you think it will shape your healthcare experience? Will you be more likely to seek out AI-powered tools? Will you feel more confident in your doctor's decisions knowing they have access to this technology?
These are all important questions to think about. AI is already changing healthcare.
Right.
And its influence is only going to grow, so it's important to stay informed,
Yeah.
engage in these conversations, and advocate for the kind of healthcare system you want to see.
This deep dive has taken us beyond the nuts and bolts of AI.
Absolutely.
It's about understanding how this technology is shaping the very future of healthcare
It is.
and ultimately our own health.
Our own health.
And as Stanford continues to lead the way, in responsible AI development,
Right.
I think we can be optimistic about the future.
Absolutely.
Now, before we wrap up, I'm curious. The professor mentioned that Stanford already has over 30 applications of AI in healthcare.
That's right. Across a wide range of areas.
Wow, that's amazing.
Hmm.
Can you give us a taste of what those are?
Well, on the administrative side, think about things like predicting patient no-shows,
Okay.
optimizing hospital bed allocation, even improving the accuracy of medical billing and coding.
Oh, so streamlining a lot of those back-end processes.
Exactly, making things more efficient.
Yeah. What about on the patient-facing side?
Well, you've got AI-powered chatbots that can answer basic questions,
Okay.
schedule appointments, even provide personalized health information.
That's pretty cool. So freeing up time for healthcare workers to focus on the more complex stuff.
Right, and of course, there are all the clinical applications we've talked about,
Yeah.
diagnosing conditions, predicting outcomes. But AI is also being used to personalize treatment plans.
Monitor patients remotely.
Wow.
Even assist with surgeries.
It really is being integrated into so many different aspects of healthcare.
It is. It
Yeah.
feels like we're on the cusp of a real revolution.
It does, doesn't it? And as the technology continues to evolve,
Yeah.
I mean, who knows what we'll see next? The possibilities are pretty much limitless.
They really are. It's an exciting time to be watching this space.
So if ChatGPT isn't the answer, what is?
Well, the professor's work at Stanford, it offers a kind of different direction. They're training AI on well, they call it the language of patient timelines.
Language. Are patients speaking in some kind of secret code?
No, not exactly.
Yeah.
But remember how we were talking about healthcare data?
Yeah.
How it's like a timeline of events,
Right.
diagnoses, medications, lab results, all those things.
Yeah.
Well, to a computer, that sequence, it's kind of like a language with its own grammar and patterns.
Oh, I see.
So it's like AI is learning to read the story of a patient's health.
Exactly. You got it.
Okay.
And by learning this language, AI can actually predict future events.
Really?
Yeah. Outcomes with really impressive accuracy.
Wow. Okay. So how is this different from the other models we've been talking about?
Well, the big thing here is efficiency. This method, it needs a lot less data to train these models.
Less data. Okay,
Yeah.
so that's a big deal.
Yeah, huge. They found that they could get the same level of performance
Okay.
with just a small sample of cases compared to a model that was trained on mountains of data.
That's amazing. So less data, faster training. Sounds like a win-win.
It is. It's definitely promising, but as with anything powerful, got to be careful.
Yeah.
Stanford's very aware of that. They're working hard to ensure this technology is, developed and used responsibly.
That's good to hear. They're taking
Yeah.
a cautious approach. Okay, so we've talked about a lot. We've talked about the challenges with healthcare data, the different ways AI is being used. I mean, diagnosis, treatment, end-of-life care. We talked about the need for workforce capacity, policies, making sure everything works together.
Making sure it's not just about the tech itself.
Yeah, exactly. And we even touched on generative AI, the hype, the reality.
The good and the bad.
Right. It's a lot.
It is.
But it's fascinating to see how AI is already having an impact.
It is. I mean, think about the Green Button Project.
Yeah.
Helping doctors make decisions in real time, discovering new subtypes of heart conditions.
Pretty incredible.
Yeah. It really makes you wonder what's next, what's around the corner.
It does feel like we're just at the beginning.
We are, yeah. It's a rapidly evolving field.
What's cutting edge today could be, completely outdated tomorrow.
Absolutely.
It's exciting. It's a little bit scary too.
Yeah, it is.
AI has so much potential.
Yeah.
But we got to make sure it's used for the right reasons.
Right, for good.
Yeah.
And the professor, he really, really drives this point home. AI in healthcare, it can't just be about the technology.
Right.
It has to be about people,
Yeah.
about actually making a positive impact.
Empowering doctors, improving outcomes for patients, creating a system that's fairer for everyone.
Yeah, that's the goal.
Okay, so for our listeners out there, as all this continues, how do you see AI changing your experience with healthcare?
Right, think about it. Will you be looking for AI-powered tools?
Yeah.
Will you feel more confident in the decisions your doctor is making, knowing that they have access to all this information?
Those are good questions.
Yeah, AI is already changing things,
It is.
and that influence is only going to grow. So it's on us to stay informed,
Right.
to be part of the conversation,
Yeah.
and really advocate for the kind of healthcare we want.
I think that's a great point. We've gone way beyond just the basics here.
We have.
It's not just about understanding how AI works.
Right.
It's about how this is all going to impact the future of healthcare.
Absolutely.
And in the end, our own health.
Our own health.
Exactly. And, with Stanford leading the way, doing this work responsibly,
Yeah.
it makes me feel hopeful.
Me too.
Optimistic about what's to come.
Yeah.
Now, before we go, I'm curious. The professor mentioned that Stanford already has over 30, like, applications of AI in healthcare.
That's right, yeah.
30.
30. All sorts of things.
Wow.
Yeah.
What are some of those? Can you give us some examples?
Sure. I mean, on the administrative side, you've got things like predicting patient no-shows,
Okay.
optimizing hospital bed allocation,
Yeah.
even things like improving the accuracy of billing and coding.
Oh, so making all that back-end stuff more efficient.
Exactly, yeah.
Yeah.
Just streamlining everything.
Okay, cool. What about on the, like, patient-facing side? What's happening there?
Well, there are AI-powered chatbots. They can answer basic questions,
Yeah.
schedule appointments, even provide like personalized health information.
Oh, wow.
Yeah.
So it's freeing up, like, healthcare workers' time
Exactly.
to focus on the things that really require that human touch.
Exactly. Yeah. Let them focus on the complex cases.
Okay.
Yeah.
And then, of course, all the clinical applications. We talked about diagnosis, predicting outcomes. But, I mean, AI is being used to personalize treatment plans now.
That's right.
Monitor patients remotely. Even assist with surgeries.
It's amazing.
It is. It's really amazing. I mean, it's being woven into, like, every aspect of healthcare.
Yeah, it really is. And
Yeah.
it does feel like we're on the edge of a real revolution.
It does, doesn't it? I mean, the possibilities, they
It
really are
does.
endless. I mean, as this all keeps developing,
Yeah.
who knows what we'll see? It's an exciting time.
It is an exciting time to be in this field.
Yeah. And it's not just about, inventing something new. It's about doing it the right way.
Exactly. Yeah.
Ah.
Thinking through all the implications.
And that's what's so impressive about what Stanford's doing, right? They're not just racing to, create the next big AI thing. They're really taking the time to make sure it benefits everybody.
Right. Patients, doctors, the whole system.
It's that combination, the research and the responsibility, that makes them, well, leaders in this field.
Absolutely. It's what we need more of, honestly. You can't just build powerful AI and then, hope for the best.
Got to think about the consequences.
Exactly. Make sure it's aligned with our values, that it's serving a good purpose.
Yeah, yeah. Okay, well, we've covered a lot of ground today.
We have. It's been quite a journey.
The challenges of healthcare data, all the amazing ways AI is being used. I mean, diagnosis, treatment, even end-of-life care.
Right. Things that, a few years ago we wouldn't have even imagined.
Exactly. And we talked about the importance of having everything work together.
The technology, the people, the policies.
The whole ecosystem.
The ecosystem, yeah.
And we even touched on generative AI, all the excitement around that, but also some of the reality.
Implementation.
Yeah. So for our listeners, the takeaway here is stay curious, stay informed.
Stay engaged.
Yeah. This is happening now. The future of healthcare is being shaped right in front of us. And it's up to all of us to make sure AI is used to build the kind of system we want.
A system that's more equitable, more
Yeah,
accessible, more
yeah.
human.
Exactly.
That's what it's all about.
And on that note, I think it's time to wrap things up.
I think so, yeah.
But keep exploring. Keep asking questions. Keep diving deep. And we'll see you next time.